Hey everybody, Dr. Rob here, Facebook Live once again. How you doing out there? I got a great topic for you. It was requested by a couple of the followers, and we're going to talk about elbow injuries, tennis, and golfer's elbow. Very, very common injury. Really interesting in that, just to give you a little preview, a lot of the elbow injuries really come from lack of shoulder mobility. So if you have somebody that has some shoulder mobility problems and or any kind of tennis elbow or golfer's elbow, tennis elbow, golfer's elbow, share this information. They're really going to find it. I'm going to explain it all to you, tell you how to assess it, where to go, and I've got some treatment protocols over here for everybody to consider. So without further ado, let's talk about elbow injuries. Let's start with the most common one, tennis elbow. Tennis elbow is on the outside. The interesting thing about tennis elbow is people go in or come into my office and they say, how do I have tennis elbow when I don't play tennis? Well, you don't have to play tennis to have tennis elbow. It's very common in tennis, but tennis elbow refers to the outside or the lateral side of your elbow. It's what we call extensor muscles. Here are all your extensor muscles. Now, the interesting thing about the extensor muscles on my shirt, there's my elbow bone or my epicondyle or whatever, where the joint meets. The muscles go above. So we're going to do a little anatomy, and I forgot my model, so we'll do what we can without my elbow model. Sorry about that. That was my fault. Not enough fish oils today, everybody. It's all my fault. But I did take my SPMs and probiotics. Nevertheless, let's talk about the elbow here. So that tennis elbow is the extensor idea, and it's this. Extensor refers, the idea of extensor really refers to the idea of extending, lengthening muscles. So interestingly enough, anything with extension, most commonly in tennis, the backhand. So there's 6 muscles that are usually implicated in tennis elbow, 2 in particular, the most common. It's the extensor carpi radialis longus and brevis. When you look at the name, the brevis is the shorter one because it has brevity, and the longus is the longest one because it says it inherently in the name. The longest really goes above the epicondyle right in here, and the brevis is right below. So when people say it hurts right here, it hurts right on the bone, it hurts right under the bone. Interesting. This epicondyle has a little hook, and the muscle goes in and under the hook. So when I do a soft tissue release called active release, I have to come in and literally keep my thumb flat and hook under that epicondyle. And that's one of the reasons that it's so difficult to truly resolve, because the insertion of the muscle gets thinner. They call that a tendon, and tendinous insertion is really thread-like on the bone. That tendinous thread-like insertion is protected by the bone, so it's very hard to get at with your hands or any kind of instrument, and it also poses a problem because it's protected so much by the bone. And it's so thin that it's so easily pulled and torn. Now, tennis elbow typically refers to, or at least is a classic example of cumulative trauma disorder or overuse syndrome. You use it, you use it, you use it. So, extensor carpi radialis longus, brevis, supinator. So supinator muscle right in here, really where the radial nerve goes through. You have your different extensor tendons. You have, believe it or not, your brachioradialis is also implicated. Your brachioradialis is when you go like this. This is your bicep. This is your brachioradialis. You see that muscle right in there. And those are typically the 5. You could also speak a little to the triceps, the 3-headed muscle, and the end portion of the tricep, or the extra muscle that aids in the last 5 degrees of extension, called your anconeus, which is literally right over here. So 6 or 7 muscles that are really implicated in tennis elbow, they are deemed overuse. The way I would diagnose it, other than palpate the specific area, is I would do something called Cozen's test, which would be basically have my wrist in extension and press, and people go, oh, that hurts. Mills test, another test where I would truly try and flex at the end. Pulling at all the extensor tendons will cause a lot of pain. Mausley's test, probably my favorite test, where I press on the middle finger and people feel it. It really differentiates between the 2 heads of those extensor carpi muscles. So those are 3 tests other than palpation that are really speak to which muscle and if you have tennis elbow, other than just the pure palpation. Some interesting asides from it. How do you get it? Well, I said overuse. What kind of overuse? Backhand. Pulling movements will also do that. A lot like golfer's elbow, hammering movements and the like. So any kind of movement where you're moving like that will overuse these muscles. An interesting FYI, the data has indicated there's also a nerve involvement when you damage the outer portion of your tennis elbows. There's a nerve, so there's a neurogenic. It's something called substance P that we've tested for, and we see that. So it's not just muscle, FYI. It's typically not just muscle. There's always a nerve involvement, and believe it or not, there's typically a circulatory involvement with all these injuries. But let's stay on the lane, let's keep it simple, and let's talk about the muscle and the tendon injuries. So that really depicts what's going on in the tennis elbow area. However, what I've noticed empirically in my office, interesting, is if you don't have shoulder range of motion, what happens is, so I can't get my arm above my head. Look at the position of my elbows. It's bent. Everything's stressed in here, causing an overuse, a breakdown of your elbow musculature region. In addition, without that flexibility, think about it, somebody just came in yesterday and actually had tennis elbow but was playing golf because they can't keep their arm straight. They have to bend their arm and they get that pressure in their elbow. So the lack of elbow flexibility, shoulder flexibility is going to put a strain on your elbows because we're put together by interconnecting joints. Interconnecting joints speaks to the fact that the shoulder is a very mobile joint, but the elbow is a stable joint. If we don't have mobility in the shoulder, we've got to pick up that mobility movement somewhere else. We move our elbow too much, we stretch the muscles too much, hence we get what most people refer to as tennis elbow or lateral epicondylitis, ultimately leading to lapel-epicondylopathy, a pathogenesis of the tendon if it stays too long. So itis is inflammation, osis is degeneration, just as an FYI as far as information is concerned. Some other reasons why you may get tennis elbow is your core. And we've talked about this before. The purpose of your core is to hold tight. You don't go like this. You don't see tennis players move like that. They hold and they move right across. If the core is weak, you need an extra movement in your shoulder, extra movement in your elbow, certainly if your shoulder. So if your core is weak and your shoulder doesn't move, you're definitely going to get a good chance of getting lateral epicondylitis. So a lot of people I treat, I also want to activate their core muscles. In addition, speaking of their core, people who have weak glutes also have a tendency on the side of the glute, the opposite side, they have tennis elbow. Because what happens is they drop down and they have to move more with the opposite side to ambulate themselves. So once again, as we always said in functional movement, he who treats the side of pain is lost. You do have to do these structures, but if you want it to resolve, you may have to look past the point of injury, look at the whole functioning kinetic chain or functional anatomy to really understand what is going on and what is truly causing that injury to get clinical outcome. Let's flip over. Let's look at the inside of the elbow. Let's talk about golfer's elbow or medial epicondylitis. One thing I will tell you, when you go in, everybody's a little tender. I don't like that right now. John's sitting there going, mine's hurting right now. So when you go in there, the two big muscles here are the pronator teres and the flexor carpi ulnaris. The pronator teres looks like this. Pronator, pronate, teres, two muscles right here. They're in two different bones as they come through. Very interesting thing about the pronator teres. You see me grabbing my shirt? That's the median nerve. The median nerve goes right through the pronator teres to come down in here into the carpal tunnel. A lot of people who have injuries with the pronator teres and or golfer's elbow have some sort of median nerve involvement. Remember, it's muscle. It can be nerve. So there's your pronator teres. Your flexor carpi ulnaris comes all the way here and is right there in the epicondyle. What's interesting, that flexor carpi ulnaris, is right near adhesing, unfortunately sometimes, to the ulnar nerve. So the inside, you're going to get a tremendous amount of possibilities of nerve involvement, ulnar and median. The outside over here, you're going to get the radial nerve. People need to understand there's a nerve involvement. Once again, I'm going to tell you, chiropractic is the choice to come to if you have any one of these injuries. So golfer's elbow, which is medial epicondylitis, swimming in the pulling motion in swimming, hammer, raking leaves, all the stuff, that home stuff that I don't know how to do, thank God, and there's no reason why I should have problems in my elbow. What we do as chiropractors, we go like that a lot to manipulate and use a lot of soft tissue work, so I get a lot of tension. Once again, there's your pronator teres, there's your flexor carpi ulnaris. All attributed, once again, shoulder could be overuse, etc. Same things apply that apply to the lateral epicondylitis, except for it's a different position, and they're flexors. It's here. Lateral extensors, it's here. With all that being said, let's talk about treatments. Of course, chiropractors, I would definitely think, I would always trace everything back to the neck and the nerves. Start with here with the scalenes, with all these nerves coming down, it's a great choice. Definitely look and possibly manipulate the shoulder, the neck, etc. And of course, clear the joints in the elbow. With that also, what other things do I recommend? Soft tissue, absolutely. Any kind of soft tissue technique I'm a big proponent of. Breaking up the different muscle adhesions, mention active release multiple times. Any kind of nerve entrapments, nerve flossing and the like. My man, Todd Riddle and Jessica from Factor, big proponent of Factor. Get in there with motion, using a band. I like to use it statically first. I like to use it with motion, and then I like to use it with weight or a band. Factor breaks up all muscle adhesions, and if needed, if done appropriately, will also start fibroblastic proliferation to allow collagen to break down. You're breaking up scar tissue. What I love about the Factor is it's different points. You're doing static into motion and weighted, and you're shortening to lengthening the muscle to allow for the perpendicular lying down of that fibroblastic proliferation leading to collagen. My choice in instrument-assisted soft tissue mobilization Factor. So big shout out to them. What else would I use? Well, myocardial laser. Everybody knows I have a plethora of different lasers out there, or as John said, he has a synonym for me because John and I have this convivial relationship now. He said a cornucopia, but I'm just going to use the accelerate right here, and I would use the laser to point in the direction. What I love about the laser, the light laser, is that light stimulates the healing at a cell level. It allows, again, for the fibroblastic proliferation, oxygenation, neurotransmission, and overall tissue regeneration. It's fixing the body from inside out. And what's great about it is it's light, goes right in there. And when you do different techniques like active release, there's tiers, there's levels. It took me a long time to get the touch, and I do not have the touch that someone like a Mike Leahy does. Even the Factor, I feel pretty comfortable with it. I still don't have the expertise of a Tom Hyde or Todd Riddle, and I know I'm on film, and I have no problem saying that. That doesn't mean I'm not competent with it. So it takes a while to learn everything. Point and shoot with this laser, Johnny's as effective as I am with it, etc., etc. So the laser is a great modality. Again, it's the most versatile modality, I believe, of the 21st century. It's been labeled by Dr. Oz as the no-pill pain buster. So for musculoskeletal and nerve, laser is a great choice. TheraBand does a great job in that they do a lot of taping. So you could tape in a particular area. I'm not going to be able to do that. I have my shirt on. I happen to like the Performance Health TheraBand tape right over there, Performance Health TheraBand, as a choice tape to use. And of course, I'm a big proponent of rehab exercises. So here I printed out a list of rehab exercises. Here's lateral and medial epicondyle exercises. I could go through them, but I took this right off. I'm an ambassador for them. What a great job. Web exercises, and within that they have all the different medial and lateral epicondyle exercises. I'll show you one tool in particular that makes a lot of sense. But clearly, we all know that we're going to lengthen for the lateral portion, and we're going to lengthen for the medial portion and do some strengthening. They're there, and they're nice enough to also carry TheraBand stuff, and it really pertains to what? what we like to call is the Easy Bar, the Tyler Twist. I happen to have one of those right here. I happen to have the green one. It's a little thick. I just ran out. I gave my last patient the red one. So this is a great choice because great choice. This is the Easy Bar right here, the TheraBand Flex Bar, proven research. It's got a poster. It'll walk you through all the rehab exercises. The rehab exercises are a critical component. If you don't give the exercises to the patient, they're not able to do the homework. That homework is going to be critical to getting your maximum clinical outcome. And everybody knows I'm a nutrition guy. So here's two particular products that every patient gets that has tennis elbow or golfer's elbow. EC Matrix. EC Matrix refers to the idea of extracellular matrix, everything outside the bone. Tendons, ligaments, cartilage, and fascia. Now, we could go through a whole dissertation on this. These things are critical elements because they're damaged. We release at the time of injury something called matrix metalloproteinases, our body's own proteolytic enzymes. They come out at a time in abundance of injury. The unfortunate thing is when they come out in abundance, they eat healthy collagen in the area. When I depict that or describe that, that's tendinitis going to tendinosis, which then is degenerating in the local area. Most people walk in the degenerative phase. So we want to modulate the expression of these proteolytic enzymes, MMPSs, because by modulating them, we're not going to allow healthy collagen or fibrocartilage to break down. This is a great choice for tennis elbow, not allow it to get into a degenerative area where we're really going to take longer to heal. You want to kind of do this in the first few days of injury. And specialized pro-resolving mediators, I was just having a conversation with somebody on the phone, and they said, give me 3 things about SPMs that take away. Number 1, they enable you to resolve inflammation. It doesn't shut it off, but they enable you to resolve inflammation. Ultimately, you need the resolution of inflammation to allow tissue to heal. But within the concept of resolution, the bigger concept, step number 2, is they allow for a homeostasis of the body and a balance of the inflammatory phases between initiation and resolution. They don't allow initiation to go too high, where you would have degeneration, but it allows the resolution, if this were a graph, of inflammation. So that homeostasis is a big component. And number 3, they still work synergistically with fish oils. So for tennis elbow, these are 2 of my recommendations. I believe that a lot of tennis elbow, 6 to 8 visits, you're going to see a classic good outcome, certainly 50% better. I'm a big proponent in communicating what's wrong with the patient, allowing them to know where they are, give them a diagnosis, tell them what the problem is, tell them how to resolve it, and please give them these steps or choose from the menu, if you will. So if you got any questions, I'd love to answer them.
Does all elbow pain fall into those 2 categories?
No, great question. Not all elbow pain falls into those categories, though I will say those are 2 of the most common, and that's, on Monday morning, if you were to have elbow, you will see those 2.
Got it. And then for people who are spending more time in the gym and have pain when they're doing like bench press or pull-ups, is that something that you would attribute to one of these causes, or would you have to look a little bit deeper?
With the pull-ups, you're going to see a lot of people, once again, have a little trouble with the shoulder. Remember, when you're pulling up, you're using the lat dorsi, going to the inner portion of the shoulder, not having that particular flexibility. And look what you do at the top of a pull-up. Look how tight and overused you may use your elbows. Their core might not be strong enough to hold them in place. And bench press, once again, you have your hands in a position, your shoulders may not be flexible. You may start kicking the elbows out, and once you do, those shorter, thinner muscles on the big lift, like a bench press, really a full upper body lift, may be exposed and overused really fast. Plus, remember, triceps are used a lot in a bench press, and they are ancillary to all the other moves, and they may be overused from poor form or too much work. The same speaking to the biceps in a pull-up.
Cool. And where can people find you?
Everybody can find me at 311 North Street, White Plains, New York, 914-287-6464. Take a look at my book, Inside Out Health, A Revolutionary Approach to Your Body. Share this information. Do me a favor. You're going to see me. We got a great video to come out tomorrow that we did on TV. It's all about CrossFit and exercise. Don't forget, Dr. Rob, always yours in health.